18.8 million people in the United States population faces tough challenges and sometimes devastation due to a disease called diabetes. If you are not familiar with what diabetes is, it's a lifelong, serious disease that people have when their body cannot use the food that they eat to break down into energy the proper way without having oral medications or insulin injections to help break the sugars down. Otherwise, it just is the extra sugar that's broke down from the food is dumped into a bloodstream, which causes high blood sugar. Diabetes affects people of all ages. It affects men, women, and children. And I chose to do my topic on diabetes because I have been a diabetic for 30 years. And my doctor educates me on all of the new updates on diabetes every time I follow up with my visits. I'm going to teach you today complications of diabetes and some of the things that you can do to prevent the complications. The very first, number one, most important thing for a diabetic to be able to do is to monitor blood sugars. Keeping blood sugars within normal limits prevents complications. A goal range for normal diabetic is a number between 70 and 110, but that varies between different people, different ages, different lifestyles. That is something that you have to set up with your doctor. They monitor with you different things between exercise, nutrition, and medication to see what works best for you. Monitoring blood sugars is a very simple thing, as you can see in the picture. It's just a prick of the finger. You get a small drop of blood. You apply it on a test strip, and you can have a blood sugar reading within 5 seconds. Kathleen Stanley wrote a book on tips of taking control of diabetes. One of the topics that she talked about is nutrition. Nutrition is important for diabetics because everything that you eat and put into your body affects what your blood sugar can be. A lot of diabetics do calorie count, which can range anywhere from 1,500 calorie diet up to 2,200 calorie diet. It depends on your age, your activity, whether you're male or female. It depends on what your body requires for calories to function daily. Proteins is a good source of nutrition for diabetics. It not only is good for energy, but it doesn't raise the blood sugar as much, and it also promotes with healing of diabetics. Weight control also falls in with the nutrition. Fruits and vegetables are good for you to eat. They don't always necessarily cause a lot of weight gain. They don't elevate blood sugars that much. And of course, a diabetic, doctors like to keep them within a normal weight range. If diabetics are overweight, it requires more medication, and they're less likely to absorb the insulin if they're on insulin injections to control their blood sugars. Another important thing is activity. Exercise helps to lower blood sugars. It helps to take the energy that you get from your food and use those sugars as energy, which also helps to decrease the blood sugar. And then you require less use of insulin and a lower dose of oral medication as long as you can stay active. And being active needs to be consistent so that the doctor knows how to adjust your activity with your diet and your medications. Kenneth Shaw and the American Diabetes Association wrote a book on complications of diabetes. And there are a lot of complications with diabetes. It affects every organ in the body. Retinopathy is one of the first ones that is mentioned. Retinopathy is an eye disease that is really common for diabetics. It's where the retinas, due to high blood sugars, will bleed out, and it is the #1 cause of blindness in diabetics in the United States. Retinopathy, after 10 years of being a diabetic, increases 40 to 50%. After 20 years of being a diabetic, usually 90% of people have signs of some form of retinopathy. And I'm proud to say, after being diabetic for 30 years, I have no damage done to the retinas of my eyes, thanks to my parents probably for teaching me good control. Miles Fisher and American College of Cardiology talks about cardiac health. Heart disease is very common in adults that are diabetic. Adult diabetics are 2 to 4 times at higher risk for developing heart disease. or stroke, and 68% of people with diabetes have heart disease or have a history of strokes in the past. Kidney disease also is a complication of diabetics. When they have poor control of blood sugars, it causes kidney failure, and a lot of diabetics that have kidney failure have regular doctor visits that they have to go for dialysis, which is removing of the toxins of their body because their kidneys aren't functioning well enough to do that. Neuropathy is another very common complication in diabetics. Neuropathy is nerve damage, and it mostly affects lower extremities, which would be your legs and your feet. 60 to 70% of diabetics have some sort of nerve damage. It's the leading cause of diabetic wounds, ulcers, and also amputations. So, for example, if there's a diabetic that has a more severe case of neuropathy, they don't have feeling in their lower extremities or their feet, so they could be outside, they could step on a nail or step on a piece of glass and they could have a wound. And because of poor blood sugar control, they could develop an infection, and their body doesn't have the ability to fight that infection, and then it gets worse, and then that's what causes amputations of lower extremities in diabetics. All diabetic complications can be prevented. The key is compliance and monitoring the blood sugars. If diabetics can keep their blood sugars within normal range, they don't develop as many complications. They need to visit their doctors regularly and stay compliant with the plan that is set up with them and their doctor. So if you know a diabetic, I encourage you to explain to them that being compliant is very important. Compliance and control leads to a long, healthy, normal life, which lowers the risk for devastating complications. Diabetics who choose to monitor their blood sugars and stick to their tight regimen that their doctors have set for them have chosen to live.